Good morning. It's August 28th, and this is your daily brief in science. Here's everything you need to know. Recent research indicates that ocean acidification could weaken shark teeth, making them more prone to damage. The study examined 16 intact shark teeth as controls and 36 teeth exposed for 8 weeks in tanks with pH levels of 8.1 and 7.3, which simulate current and future ocean conditions. Results showed that water with a pH level projected for the year 2300 caused more damage to both roots and crowns of the teeth than current ocean water. This increased brittleness could impair sharks' ability to hunt effectively, threatening their role as top predators. The study focused on discarded teeth from blacktip reef sharks, species that rely on sharp, replaceable teeth for survival. Limitations include the small sample size, lack of live shark testing, and variability across different species, which leaves questions about the real-world impact. The research also notes that the extreme acidity levels tested may not occur in oceans in the near future. Separately, rising sea temperatures are causing coral bleaching, with some areas of the Great Barrier Reef experiencing up to 80% coral mortality. Bleaching events are now happening 4 times more frequently than in the past. Addressing these threats involves global efforts such as reducing carbon dioxide emissions through agreements like the Paris Climate Accord and protecting marine ecosystems with reserves. 7 years after Paul Allen's passing, his estate has launched a $3.1 billion fund for science and technology to support innovative research in bioscience, environmental science, and artificial intelligence. The foundation, managed by trustees including Allen's sister Jody Allen and Steve Ballmer, was quietly developed over 3 years and aims to make long-term, high-risk investments in scientific fields. It plans to deploy at least $500 million over 4 years, starting with $15 million in grants to Seattle-based institutions like the Benaroya Research Institute and the University of Washington. The foundation emphasizes funding early-stage projects that traditional sources may overlook, aiming to accelerate discoveries and address global challenges. Unlike the Gates Foundation, which focuses on later-stage implementation, FFST is discovery-oriented and initially concentrates on the Pacific Northwest, with plans to expand nationally and internationally. This initiative comes amid reductions in federal research funding, with the U.S. government cutting billions from NIH grants, highlighting the importance of private philanthropy. Led by Dr. Linda Stewart, a former Gates Foundation executive, FFST aims to fund transformative ideas and translate concepts into early clinical trials to solve large, costly problems. The Foundation's initial grants will support projects in bioscience infrastructure, cancer treatment, environmental research, and pediatric clinical trials. This effort reflects Allen's belief in technology's potential to solve major issues and continues his legacy of innovation. Overall, FFST seeks to catalyze scientific progress by filling funding gaps left by declining federal support and promoting responsible AI and sustainable solutions. Meanwhile, federal agencies like the CDC have scaled back their monitoring efforts, such as reducing foodborne illness surveillance from 8 pathogens to only 2, indicating a decline in public health tracking. A new study from Baylor College of Medicine has identified NF1 gene depletion as a potential biomarker for predicting increased sensitivity to CDK4/6 inhibitors in estrogen receptor-positive breast cancer. NF1, which encodes neurofibromin, normally inhibits RAS pathways, and its reduction may lead to higher CDK4/6 activity. Tumors with lower NF1 levels tend to respond poorly to traditional endocrine therapies, but show improved responses to CDK4/6 inhibitors in preclinical models, including animal studies based on patient tumors and data from clinical trials. When combined with estrogen blockers like fulvestrant, CDK4/6 inhibitors have resulted in sustained tumor regression in these models. Developing clinical assays to reliably measure NF1 levels is challenging, but techniques such as immunohistochemistry and mass spectrometry have been created for this purpose. The goal is to use NF1 status to personalize treatment plans, selecting therapies that are more likely to be effective based on tumor characteristics. Further clinical research is needed to validate NF1 as a dependable biomarker and to establish standardized testing methods. Upcoming trials that incorporate NF1 assessment are essential for confirming these preclinical findings and advancing individualized breast cancer therapies. This research involved collaboration across Baylor and Washington University, supported by grants from NIH, DoD, and Texas research institutions, reflecting significant societal investment. Ultimately, identifying biomarkers like NF1 aims to improve patient outcomes by reducing unnecessary treatments and associated side effects, moving toward more precise, molecularly tailored cancer care. Eli Lilly has announced positive results from the Phase 3 Monarch-E trial, showing that 2 years of Verzenio combined with endocrine therapy significantly improves overall survival in patients with high-risk, HR-positive, HER2-negative, node-positive early breast cancer. The trial involved 5,637 patients across 600 sites in 38 countries, focusing on a population defined by tumor size, grade, and lymph node involvement. Results indicated a statistically significant and clinically meaningful survival benefit, supporting Verzenio as an effective treatment option for this group. A 7-year follow-up confirmed that Verzenio offers sustained benefits in invasive disease-free survival and distant relapse-free survival, with no new safety concerns reported. The long-term data reinforce Verzenio's role as a standard of care, demonstrating durable effects over 7 years. Its safety profile includes risks such as diarrhea, neutropenia, ILD/pneumonitis, liver enzyme elevations, and VTE, with management strategies outlined for adverse effects. All patients had completed or discontinued the 2-year Verzenio course, and safety remained consistent with previous reports. Further results will be presented at upcoming medical meetings, published in peer-reviewed journals, and discussed with regulatory agencies, solidifying Verzenio's position as a treatment option. Verzenio, an oral CDK4/6 inhibitor, is approved for HR-positive, HER2-negative breast cancers in both adjuvant and metastatic settings, with data supporting its inclusion in treatment guidelines, including NCCN recommendations. The FDA approved abemaciclib for adjuvant use in high-risk hormone receptor-positive, HER2-negative, node-positive early breast cancer with a K167 score of 20% or greater in October 2021, with expanded indications in March 2023. The trial's design included 2 high-risk cohorts, with treatment lasting 2 years and endocrine therapy continuing for at least 5 years if appropriate. Previous findings demonstrated a 25.3% reduction in recurrence risk, with 5-year data confirming sustained efficacy and improvements in IDFS and DRFS. Overall, the results validate the survival benefit of Verzenio, with safety profiles consistent with earlier data, further establishing its role in treating high-risk early breast cancer. Research into lipid nanoparticles, or LNPs, used in mRNA vaccines reveals they can trigger different responses in dendritic cells. These immune cells are key in detecting foreign substances and orchestrating immune reactions. A recent study from Belgium, published in Cell Reports, shows that LNPs carrying mRNA-encoded antigens activate dendritic cells to stimulate T cells, promoting protective immune responses. Conversely, LNPs containing peptides or empty LNPs tend to support immune tolerance, reducing inflammation. The study highlights that empty LNPs do not provoke significant inflammatory responses, addressing safety concerns related to vaccine components. This dual response indicates that LNPs can be engineered to either enhance immunity or promote immune tolerance, depending on the desired outcome. Scientists used advanced techniques like cytosequencing and flow cytometry to analyze these responses in detail. Understanding how LNPs influence dendritic cell behavior is crucial for developing safer, more targeted vaccines. The findings are especially relevant given the widespread use of LNP-based COVID-19 vaccines, providing reassurance about their safety. They also open possibilities for creating vaccines for autoimmune diseases that aim to induce immune tolerance. Overall, this research offers a blueprint for future vaccine design, emphasizing the importance of molecular cues in shaping immune responses. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.